You will be hospitalized as an inpatient for treatment each cycle. After the initial 8 cycles, you will have another battery of tests. The antineoplastic will inevitably affect some healthy cells, including those lining the gastrointestinal tract from the lips to the anus and the hair follicles. We will, of course, be relying on your resolve to withstand some of the more pernicious side effects. The first week of each cycle, you'll be hospitalized for chemotherapy. The next week, you may feel a little tired. The next 2 weeks will be fine, relatively.
It's 8 months like that.
This treatment is the strongest thing we have to offer you. And as research, it'll make a significant contribution to our knowledge.
Knowledge. Yes.
Here is the informed consent form. Should you agree, you sign there at the bottom. Dr. Baring?
Dr. Kalikian.
Professor Baring, how are you feeling today?
Fine.
Great, just great. Very late detection, stages 4 upon admission. Hexamethylphosphacil with vinplatin to potentiate. Hex at 300 milligrams per meter squared, vin at 100. Today is cycle 4, day 3. All cycles are at the full dose. Primary site is here, behind the left ovary. Metastases are suspected in the peritoneal cavity, mainly in this area here. Full lymphatic involvement. At the time of first look surgery, a significant part of the tumor was debulked, mainly in this area here. Left, right ovaries, fallopian tubes, uterus, all out. Evidence of primary site shrinkage. Shrinking in metastases has not been documented. Primary mass, frankly palpable in pelvic exam, all through here.
Excellent command of details. Okay. Problem areas with X and Vin?
Myelosuppression. First, of course, is myelosuppression, a lowering of blood cell counts. That goes without saying. With this combination of agents, nephrotoxicity will be next.
Anybody else? Side effects?
Nausea, vomiting.
Jason?
Routine.
Pain while urinating.
Routine.
Psychological depression.
No way.
Oh, anything else? Other complaints with Hex and Vin? Come on.
Mouth sores?
Not yet.
Skin rash?
No.
Why do we waste our time, Dr. Baring?
I do not know, Dr. Kalikian.
Use your eyes. Good grief. Hair loss.
Come on.
Doesn't count. You can see that.
Jason?
Hair loss after first cycle of treatment.
That's better. Dr. Baring, full dose. Good. Excellent. Keep pushing the fluids. Jason, clinical.
Oh, right. Thank you, Professor Baring. You've been very cooperative.
Wasn't that grand?
Hexamethylphosphacil and vinplatin at the full dose, ladies and gentlemen. I have broken the record. I have become something of a celebrity. Kalikian and Jason are simply delighted. I think they see celebrity status for themselves. Upon the appearance of the journal article, they will no doubt write about me. But I flatter myself, the article will not be about me. It will be about my ovaries. It will be about my peritoneal cavity, which, despite their best intentions, is now crawling with cancer. What we have come to think of as me is, in fact, just the specimen jar, just the dust jacket, just the white piece of paper that bears the little black marks. I was just wondering, why cancer?
Why cancer?
Well, why not open heart surgery?
Oh, well, yeah. Well, why not plumbing? Why not run a lube rack for all the surgeons know about Homo sapiens sapiens? And no way. Cancer's the only thing I ever wanted.
Huh.
No, really, cancer is...
Awesome?
Yeah, it is awesome. How does it do it? The intercellular regulatory mechanisms, especially for proliferation and differentiation. The malignant neoplasia just don't get it.
Neoplasia. Cancer cells.
Yes, that's right. You grow normal cells in a tissue culture in a lab, and they replicate just enough to form a nice confluent monolayer, and then they divide 20 times or 50 times, but eventually they conk out. You grow cancer cells, and they never stop. No contact inhibition whatsoever. They just pile up. They keep replicating forever. It's got a great name. You know what it's called?
No, what?
Immortality in culture.
That sounds like a symposium.
It's an error in judgment in a molecular way. But why? Even on a protistic level, the normal cell-cell interactions are so subtle, they take your breath away. It's incredible. It's perfect. So what's up with cancer cells? Smartest guys in the world, the best labs, funding. They don't know what to make of it.
What about you?
Me? Oh. I've got some things I'm kicking around. Wait till I get a lab of my own. If I can survive this fellowship.
It's part